Welcome to Beyond the Mask. Today's episode is a powerful one centered on healing, growth, and the critical role of peer support in the lives of CRNAs and anesthesia residents. We're taking a look back at how far we've come in recognizing and addressing the mental health and substance use challenges that can affect anesthesia professionals, and how peer-driven support networks have become a lifeline for so many. And there's no better time to reflect than now, as we celebrate the 10-year anniversary of the Parkdale Center, an institution that has been at the forefront of compassionate, profession-specific care and recovery. From stigma to solidarity, today's conversation honors the courage of those who've walked the path and the ongoing work of those who support them.
CRNA Financial Planning is a sponsor of Beyond the Mask podcast. Investment advice offered through Private Advisor Group. Nothing in this podcast should be construed as investment advice. Plus, did you know listening to our podcast can earn you Class B credits? For details on how to submit, visit the CE credit section at beyondthemaskpodcast.com. Welcome to Beyond the Mask, innovation and opportunities for CRNAs and advanced practice nurses, with certified financial planner Jeremy Stanley and CRNA Sharon Pierce. Jeremy Stanley has worked with CRNAs for more than 23 years, and Sharon Pierce is a former president of the AANA and the NCANA. Join us as we leave the operating room and learn the latest in the CRNA and advanced practice nurse industries. Beyond the Mask starts in 10, 9, 8, 7.
And we have to welcome back to the show Linda Stone. Linda, welcome.
Thank you. Thank you for having us.
Absolutely. And Jack Stem.
Thank you. It's good to be back.
And Bridget Petrillo, welcome.
Thank you.
All right. Well, let's just kind of jump into things for just a second. Let's introduce each one of you briefly so our listeners will know a little bit about your background, and then we'll kind of kick this off and get started. So, Linda, why don't you start?
My name, as you said, is Linda Stone. I've been a CRNA for 32 years. I can't believe that. You talk about things happening quickly. I have been so fortunate to be involved in peer assistance at the state and the national level. I'm also a program administrator, and so I deal with students and, lots of CRNAs and things like that. I am very involved in advocacy for our patients, but also the profession. And of course, peer support and wellness has been one of my biggest advocacy efforts probably of my career.
Wonderful. And Linda, you do a great job. And I've known Linda for many years. She still looks like she's 19 or 20. And she says she's been around for 32 years, but she's kind of like Sharon. Neither one of you really ever age. You just get better, like fine wine.
Yeah, and she's got the best legs in the business. Her and Betty Wild Gus have the prettiest legs of any CRNA I've ever known.
I see, Sharon, I wasn't going to go there.
I know you can't. I can.
Yeah, I was thinking the very same thing. I can't go there either.
Yeah.
And Jack, why don't we kick you off?
Thanks. Jack Stem. I was a CRNA for 14 years, became addicted to pain medication because of spondylolisthesis, and eventually got caught diverting and left the profession, but became a peer assistance advisor in 2005. Have been Ohio's peer advisor since then. I'm a counselor now. I work at a couple of different treatment centers here in Ohio, providing education on the disease process. I'm Ohio's representative as far as the peer assistance goes. And I just in the last couple of years started working with Safe Side Prevention, which is a suicide prevention program. My daughter, Kim, who's a recovering addict alcoholic, and I did a podcast with them last August, which I was really proud of my daughter. That's the first time she's done anything that big and public, and she did a great job. So this has just become my life. I celebrated 30 years recovery back in March, the day before I performed the wedding for my daughter. So it's been an interesting 30 plus years.
Always seems like it's such an interesting ride, doesn't it, Jack?
Yeah.
You never know where we're going until we look back. So
Yeah, it's been interesting.
All right. And Bridget?
Hey, good morning. Thanks so much. It's an honor and a privilege to be here and to meet you guys on Zoom. I listen to your pod all the time. Yeah, I've been a CRNA since 1995, and I've been in recovery since 1999. I'm a recovering fentanyl alcoholic addict. I've lived in California, Connecticut, Arizona, and now I live in Galveston, Texas. Been involved in peer assistance since 2014 when Art Zwirling dragged me in, and I had the beautiful honor and privilege of being part of the peer assistance committee and meeting Linda and Jack since then, and Rigo too, who we will discuss. But yeah, so thank you so much for that introduction.
Don't we all miss Art? Oh my goodness. Whenever I was AANA president, anytime someone called me with a problem, all I had to do was call Art and he took care of it immediately. What an amazing man who will always be missed.
Yes.
Amen.
Yeah.
Absolutely.
Well, we all know that AANA has been a leader in the industry in peer assistance. And now, I believe there's been a partnership between Parkdale and AANA. So we can talk a little bit about that. Can you tell us a little bit about that history with the AANA and the peer assistance? Either one of you, I'm not sure who wants to kick this one off, but anybody who wants to take that one.
If y'all don't mind, I'd like to start, and if others want to chime in, that's true. I felt like this was a really important thing to talk about because, so often when we talk about it, people think that it starts at the point where they come into it. And, as one of my mentors, and I know some of yours too, Sandra Ouellette, says all the time, we all drink from wells that others have dug. That may not be the exact thing, but that's how I remember it. And so history is really important because I think it really informs the present and the future. So in 1983, I think you said something about that. The ANA really was, one of the first in our professional associations to get involved and formed like an ad hoc committee on chemical dependency because they realized that substance use disorder, was a real issue, an occupational issue for anesthesia providers. And then that grew into the ANA Peer Assistance Advisors Committee, which for many years did educational outreach to not only nurse anesthesia programs, but also groups of CRNAs. Art Zwirling, as you mentioned, was a dynamo. He's irreplaceable. He went above and beyond. And I was fortunate enough to get involved because I've started asking him questions on email. And the next thing I know, he said, "Hey, do you want to join AANA Peer Assistance Committee?" And I was like, "Yeah, but, I really don't know anything." He said, "Good enough. You're interested." So that's how it started for me. But like I say, our history is long, and ANA has certainly evolved in that and has been a leader in professional associations. And again, when you think about all the things we've accomplished, we're going to talk about that, I know, later. I mean, there's just been so many people involved. And I really wanted to recognize those people. Art, we mentioned, but there was also Rusty Ratcliffe and Diana Quinlan and, the three of us and many, many others who have come before and after us, including Rigo. And we each have a story about Rigo and how we met. And actually, Sharon Pierce was a part of that too. So, again, I love relationships and looking about all that. But that's it in terms of the history. It's just been incredible, I think, what has happened with the evolution of that.
One of the things I find interesting is that an article was written by a CRNA in 1962 about the problem of addiction in the anesthesia provider. And it took another 20 years before the AANA finally said, well, we ought to really look at this. And then once they did, it just took off. So this is nothing new. Dr. Paul Early, who was one of the early directors of the Talbot Recovery Center down in Atlanta. And they were one of the first treatment centers to treat healthcare professionals. I'll never forget at a conference, he said, anesthesiologists make up 4% of the physicians in the United States, but they're 25% of the physicians in treatment for addiction. And I thought, holy moly, that just blew my mind.
Wow.
So yeah, it's definitely part of the profession and the risk to those who are in the profession. So it's just something we've got to be aware of.
So Bridget, what's your story and how did you get involved in all of this? outside of the obvious.
Yes, right. Outside the obvious, but I was about 10 years sober and I discovered that anesthetists in recovery, I believe it was a Yahoo group that Art Swirling had put together and, on the shoulders of Rusty. And I had spoken with Rusty when I was about a year sober. I didn't know what to do with my life. I wasn't able to work as a nurse at that time. And, I was just really struggling. We're going to talk about the phone number, but, back in the day in 1999, I would call that phone number. And like a week later, I got a call back from Rusty. But anyway, I digress. So I was part of this online Yahoo group with the other anesthetists in recovery, and I was very active in posting and talking about my story. And Art picked up on my curiosity, I believe, and invited me to apply to the peer assistance panel or committee, it was called at the time, the PAAC panel. And then, the son of a biscuit died a few months later. I'm still angry at him for dying.
A lot of us are still angry at him for dying.
But, was so wonderful because then I got to meet Linda and our paths have crossed, because it is such a small anesthesia world. And Art had this vision, probably similar to Jan Stewart and other people at the AANA, that they could see the light in somebody and bring it out. Art could see that there was something in me that could be of use to the AANA, and that, he saw that in me before I saw that in me. And that's what the Peer Assistance Advisory Committee and the panel has done for me. They've allowed me to do my best work and, assist in that peer-to-peer help. Since 2014, I've probably spoken to 400 people on the phone to, assist them in getting help and, always directing them now to the 1-800 phone number and to the website. But it's so funny about volunteerism, as you all know, we started out thinking that we're going to be doing something for somebody else, but we realized that the volunteer work benefits ourselves. And, that's very 12-step oriented or very recovery oriented for me to say that, but it's really 100% the truth. Is I do my best work and I'm the happiest when I'm helping others.
Amen. Well said.
Yeah. Well, Jack, give us a little bit of background about your story as well.
Yeah, I had spondylolisthesis and had been treated for several years for that. And in 1989, everything just kind of started to fall apart. And I began diverting, and I lost 50 pounds in 5 months on the fentanyl diet, and I don't recommend it. and I thought I was fine. I can remember looking in the mirror, shaving one time, and saying to myself, "Hey, you lost some weight, dude. You're looking pretty good." And I look back now, and it's like if I'd have walked onto the set of The Walking Dead, they would have said, "The zombies are over there. I'll be with you in a minute," because that's what I look like. I came very close to committing suicide. I walked into the hospital one day and I thought, if I get caught, my family's going to go through the mill over this. And if I died, they could explain that any way they wanted to and move on. And I had drawn up sufentanil and succinylcholine to do it. And somebody interrupted me before I could start. They didn't even know they interrupted me before I could start. And then I had surgery. And when I went back to work 5 months later, I overdosed accidentally. And then that's what got me into treatment. And that went on for like 5 years. And I finally got busted. And I was out of anesthesia 8 years. Didn't talk to anybody in healthcare at all. And one morning I got an email from a student at the University of Michigan that said, "Hey, we want you to come and talk about addiction and the anesthesia provider." And I thought, how in the world is that? So I'm going to delete the email. And then I saw they were going to pay me $500 and all my expenses. And I said, well, what the heck? I don't know anybody in Michigan. And it went okay. And then somebody asked me to come to Boston. And it turns out Lynn Reed was in Boston and she was a recovery room nurse when I was going through training, and she would grill us all the time. "Why'd you give this? I said, apply to school. You work at a hospital. It's got to, I'm not smart enough. Well, past president and all kinds of things. Anyway, she said, "I think you should be Ohio's peer advisor. We need one." And I'm not qualified, but we don't have anybody. And I said, "I'm not qualified." And Art was the next speaker. And she says, "Art, is he qualified?" And he said, "Oh, hell yeah, he's qualified." And I thought, who are you, you little... And it turns out Art and I got to be pretty good friends. And as they say, the rest is history.
Yeah. So how did each one of you get involved with Rigo and Parkdale? Was it at that time you got involved with them, Jack?
I was actually working with a licensed defense attorney here in Cincinnati. I was referring people who would call to different attorneys. And this one attorney said, "Hey, this last person you referred to me, She's got some other mental health issues. I'd like you to kind of coach her if you could. And that's kind of how that started. But one day she says, hey, there's a guy that's coming into town. He's the nurse anesthetist, and he's doing a diversion detection program for the Kroger pharmacist right across the street. Would you like to go to that? And I said, yeah, that'd be kind of cool. And that's how I met Rigo. We just kind of went from there.
Wow.
Yeah.
Bridget, what about you?
I believe I met Rigo first online, in the Yahoo group for anesthetists in recovery, which unfortunately doesn't exist anymore. I meant to mention that because Yahoo got rid of their groups, but we still do Zoom meetings once a week. But yeah, it was through that. And I think, remembering that he was quite a dynamo and very enthusiastic about helping other CRNAs, even in early recovery. And then I remember when he joined Peer Assistance, the committee.
Yeah. Lyndon, what about you? You want to talk a little bit about Rigo?
Yeah, it is actually a pretty funny story. Sharon Pierce was the president of the AANA, and I was the chair of the Peer Assistance Advisors Committee. And she would have these, which I'm going to call fireside chats. I don't remember if that's exactly what you called them, but I loved them. I thought they were so good. And I said, to her and the others who were there that, we had lost a member, to relapse, and we wanted to replace that member. And I said, so if you all know of anybody, would you let me know? And so Sharon sent a text and said, somebody's going to call you. They know somebody. And so that person called me and told me about Rigo. And I said, well, I'd like to talk to him. So give me his number and all that sort of stuff. So Rigo called, and, it was just like, had all these plans and these great ideas and things like that. And I thought, is this guy for real? Because it was just so much. And I thought, well, I'm really, intrigued and all that kind of thing. But I thought, I can't imagine he wants to do all this. I just thought, it's just too good to be true. So then I contacted Julie Rice, who was at the AANA at that time, and she was our, staff manager of the committee. And so we, set up some time to meet with Rigo and things like that. And again, he had not even started Parkdale at the time. He was just like an idea that he and his wife and, things like that had. So I was very fortunate to go and see the site before it was actually started and, meet the people, and actually had conversations with some of the people that I had talked to on the helpline and had helped, get into treatment and things like that. So it was really, just a very moving experience, for me. And of course, knowing Rigo, anybody that knows him knows that you can't help but like the guy. He is over the top, and he's very knowledgeable and all that sort of stuff. And I say over the top in a good way. He has got so much energy. It's amazing.
If you'd like to hear Sharon speak live, now's your chance. She'll be presenting at the 53rd Annual Refresher Course for Nurse Anesthetists, hosted by the Frank Moya Continuing Education Programs. Join her this fall with other experts November 14th through the 16th at the Hilton Hotel in Walt Disney World Village, Florida. It's a weekend of learning, networking, and a little bit of magic. Check out the link in the show notes for more info and registration details.
Sharon, why don't you tell the story of when we had Rigo and Linda on the show before, and the call you got, I believe you got it, from someone who was actually listening to that show, because I think that sets the tone for how powerful this is.
Oh, yes. We found out later that there was a CRNA who was having some issues and had decided to kill themselves. And they were driving, had a plan, and they were listening to the podcast. Now, I'm not sure who listens to a podcast when you're driving somewhere thinking of committing suicide, but God help us, we're glad. And the helpline number was announced on the podcast, and they called the number.
Wow.
Rigo told us about this later on.
I still get chills.
People are listening to this. So know that you're making a difference just by telling the story and providing a way for somebody. And Jack, I can see you're getting really emotional about this right now.
I've had a couple of phone calls like that before Parkdale. We had a guy that had overdosed intentionally to die. And I guess before he had taken numerous Valium and then drank a fifth of vodka to kill himself. And before he was unconscious, he typed into the anesthetist in recovery chat board, help. That's all he typed. I saw it, Art saw it, a couple other people saw it. And within the next 2 hours, I was on my way to Indianapolis to go to his house if I had to. Art had called the police and told him to do a wellness check. And he was in the hospital by the time I got there. So I got to see him at the hospital, and we had a place for him in treatment. And that all happened because of the network that we developed. I know when I called in 90, there was a little box on the bottom of the newsletter that we used to get, and it had the number, and I called the number and it went to voicemail. Now, who's going to leave a voicemail that says, hi, my name's Jack. I'm considering killing myself. I'm addicted to fentanyl. And could you call me back at your earliest? Nobody's going to do that, right? So the hotline, once Parkdale took over and had it manned 24 hours a day, 7 days a week with trained individuals, that doesn't happen anymore. So yeah, I hear that, and I think there was a higher power someplace working on that. That's for sure. And I can point out how many different instances where I shouldn't be here, where somebody intervened for no apparent reason. And again, I think it's that higher power that kind of keeps an eye on us.
Bridget, you were clearly moved too by that story. And you don't have to answer this, but I can imagine going through what you went through. Maybe something like that crossed your mind at some point.
Indeed, it did. We call it a plan B in the world of recovery addiction, that we're smart enough to know we have a problem, but, our brain is hijacked. And in those final days, when we feel that there is no option but to remove the pain and suffering, we know how to kill ourselves. We're very good at it. We would be very good at it. So I certainly had a plan B for myself, and have also been involved in students and other CRNAs who were talking about their plan B, their willingness to kill themselves, and instead of going to treatment, because our disease is so strong. It seems like a logical. It's so crazy, but it really seemed like a logical explanation to stop the suffering. So yeah, those are very moving stories. And the best part about for me personally, I find that there's two great things about the Parkdale Association with the AANA. One is the data collection. We get some really, really awesome data. And then also this helpline, because that moment is so, having been at that moment, it is a split second sometimes where you're like, I'm going to do this or I'm not going to do this. And it's like, if we could get somebody in that moment and they call that helpline and a real person answers, that makes the biggest difference in somebody's life, because there can be somebody on the other line to say, I know what you're going through. I know I can find you help. And, I was able to get and find recovery through an intervention from 8 people who came to my door at 5 a.m. to save my life, my friends and family, coworkers, an anesthesia tech, a perfusionist. So I know what that moment is like. And Rigo really has streamlined that moment. And we can't measure how many lives that he has saved. But, it's these stories that really, I love talking about them. I love feeling them. And it makes me so grateful for the AANA to be a leader in this peer support.
Yep.
It's unbelievable.
I believe, and even sharing about the situation you described with the podcast, I think a lot of people struggling with SUD, they are looking for a lifeline. They are looking for something that is going to give them their life back. And like you said, Bridget, it might be a moment, it might be 10 minutes, it might be 2 hours. But I truthfully believe that person, Sharon, that was driving that day knew what they were going to do. But the reason they were listening to that podcast is they were looking for something somewhere to give them some help. And I think the stories that we hear around this topic, it's a reoccurring, it's almost like a human innate trait.
Yes.
Survival.
You get to a certain point and you reach out. And if someone's not there, Jack, to answer that phone, that might be it. And they're done. There's just nothing for me, and I've got to end this now. I think that's what we're hearing over and over. And there might be someone listening now that, here's this, here's you guys talking, knows about this partnership with AANA, something, and they dial that number and somebody answers, and that's their lifeline. And I think that makes all of the difference.
Can I add something about that too? Having, before before Rigo, before, Parkdale, we on the committee were the helpline. We answered those calls and they came whenever they did. And one of the most frustrating parts about that was the fact that we lost a lot of them. We could talk to them and we could tell them, the things that, we would recommend for them to do. We would, have a place, we'd give them places, to call and even do some of the legwork for them. But, if they weren't ready or whatever the reason, you lost them. And then a lot of times they didn't answer their phone, even if you kept the phone number and things like that. So even before AANA had a strategic partnership with Parkdale, but just having Rigo and Parkdale there, I mean, I will tell you of some of the examples. We cut down the time of getting people into, treatment to hours, when before it was days, weeks, months. And sometimes when I say months, like 6 months, maybe, if they
I
survived.
saw 18 months.
Yeah.
Mm,
That's crazy.
that is crazy.
Another interesting thing about what Rigo does for the person, the colleague calling and asking for help, he will give them follow-up. But, sometimes there is this void of the survivors, so to speak, that these people get together, they help this person get treatment, and then they never find out what happens to them. The hospital says, shut it down, we can't talk to you, and it's nobody's business. But Rigo is allowed and able to give some follow-up for the people who are surrounding the person in need. And that has also been this ripple effect of support for the community.
Yeah.
What other differences have you guys noticed? You've named several. We now have data collection with Parkdale. We now have follow-up, 24-hour helpline. What are some other things that you guys have alluded to? How else has Parkdale made this whole process better that you haven't mentioned so far?
Of outreach too that we don't, talk about. If you remember during COVID especially, they partnered with Support the Front and some others and held, Zoom meetings, whatever we want to call them, on really helpful topics, mindfulness, they showed things where, you put your mask on, when we didn't know, the world is on fire. We don't know what to do and things like that. It was really positive. I'll have to say, I think their outreach has been incredible. And that's just me. I know that, Jack and Bridget are more involved with, some of, like they talked about, anesthetists and recovery and things like that. And so they can speak to that, but that's it for me. I think they've just done so much.
Well, I think the other thing that they've done is they've started or kept the Zoom meetings. I know they have a meeting Wednesday evenings. It's essentially a 12-step meeting without being a 12-step meeting. And it originates at Parkdale, and people that are in treatment can start the process of developing relationships with other people in recovery. And anybody who has been through treatment there is invited to join. So people sign on. We have 20 to 30 people that sign on any particular meeting. And they're from California and Massachusetts and Florida and, Alabama, Ohio, from all over the country. And if somebody's in treatment from Alabama and there's a person on that's been through treatment and maybe even be a peer advisor or a wellness ambassador now, from that state, they make that connection, which that wasn't always there. So, and I know they do one on Monday nights and Friday nights and Saturday mornings, I think. So that sober support that starts in treatment can continue once they leave, anybody who's been through treatment knows that if you don't have any sober support, once you get out, you're in trouble. And so that has created a link, I think, nationwide, which is something that we didn't have for a while. Yeah.
And I will add that Rigo has a gift, as we all know, and Claudia, his wife, is also an amazing person. The two of them together, the dynamic duo. But they will talk to a hospital or an anesthesia group. They know all about the different boards of nursing, all 50 of them, and Puerto Rico, to help the provider. Do you report in this state? Maybe this is the state that it's probably better if you don't report. We'll get you your own outpatient in your state. And he has, he knows which states have an alternative to discipline and how to go about the life after treatment, right? Because as a recovering person, you have certainly the acute phase, but then you have this life after treatment. And, am I going to lose my career? Am I going to be able to go back? And we know that many of us do go back and many of us find a better a better path. But he has this constant knowledge of this changing dynamic boards of nursing that so that can be helpful. And he knows exactly the right way to word things when you're getting your FMLA. He can help you with disability. He can put you in contact with this person. He with Julie Rice now works for Parkdale, and she is developing a network of people, right? Because again, it's that peer-to-peer support that is really life-saving for people in recovery.
Hi, this is Jackie Rolls, President and founder of Our Hearts, Your Hands, a global support anesthesia community. We'd like to thank all of our prior donors and also say that we are accepting donations, welcome donations, to send a nurse anesthetist or even a nurse from a low-resource country to get further academic education or attend professional conferences or even equipment for some companies. Thank you so much for your support.
I understand that he's got a lot of relationships with other facilities. Not everybody can go to Parkdale. I do remember whenever it first started, and you're right, I was president, and we wanted to recognize them as the premier place for CRNAs to seek treatment, but not everybody can go there. So he's been really good at developing relationships. I understand, if any of y'all could speak to that.
When Rigo first got involved, and Linda, you probably have more information about the ins and outs, but we were in the process of vetting treatment centers. We had a list of criteria from Parkdale that said, these are the things that minimally we need when we treat an anesthesia provider or a healthcare provider. So what we would vet these different treatment centers, talk to the outreach person there. They'd fill out a form and apply to be somebody that we would contact if they couldn't come to Parkdale. So we developed a chain or a network of treatment centers that treat healthcare professionals.
Well, it's a different treatment, because if a healthcare worker wants to go back to their profession,
right,
it is a whole different thing, I would think.
Yeah.
So healthcare providers have very unique needs, especially if they want to go back to work.
Well, there's a lot of people that have unique needs: pilots, truck drivers, healthcare professionals, people that have to have lawyers, people that have to have licensures in order to practice. If you've had an episode where you were significantly impaired, you have to prove that you're not impaired anymore to return to practice. And that's part of what the peer assistance program is about, is helping those folks prove that they're in recovery and continuing.
I'd like to say this too, knowing, being on the committee and knowing these two, of course, and others. One of the things that was not fascinating, but interesting to me was, I was not in recovery. So, I came at it from a different perspective, but was really seeing how wonderful all these people are. These two are lifelong friends. I feel like I can call them at, any time and talk about anything. But I think that, they had to really, live under a stigma and have dealt with stigma. Bridget's going to be talking about that at the, upcoming AANA annual Congress. But, that was huge. And I remember especially Bridget when she first started, and we would have our meetings and stuff, and people would always say, oh, well, let's ask these outside experts about this and that and the other. And I would say, why can't we be the experts? You all have lived it, and we can research and we can get involved. And so, I feel like that's a really important point, is that, we have tried to show people really how valuable they are. Yeah, they have this disease, but they're still very, very valuable individuals, and, can return to work. Maybe not everybody can return to practice, but, a lot of people can successfully return to practice.
Well, the changes that I've seen over the last decade, and Jan Stewart's the first person who put me on committee at the national level, is the stigma attached with it. I think it has changed dramatically, and I think it's because of the good work of people like the three of you guys, and people who have walked the path like Jack and Bridget and come out on the other side and live to tell about it. And given those of us who've not lived that story insight into what it is and what it's like. And then you realize by the grace of God go I that it's not me, right? So I want to thank you guys for that. But I think that has really changed people's perception of SUD.
Yeah.
We're
While
not
it has
there
got-
yet. We're not there yet.
Oh, yeah. I mean, it is significantly better. However, it's still huge. Stigma is still a huge issue, not just in the AANA or in anesthesia or healthcare, just in society. One of the things that I've discovered by accident was once I started to tell my story, which, I go to the anesthesia programs here in Ohio every year and do presentations on this whole issue. And the byproduct of me sharing my story is that my shame and guilt is gone. I think half of Ohio knows that I'm in recovery now, and that's okay. And if you're upset that I can't believe they asked this guy to come and talk to us about who's he thinking, it's like, well, that's your problem, not mine, pal, But it is one of those things that I think is always going to be there, which is why it's so important for those of us who have long-term recovery to talk about the fact that recovery happens. The last 5 years, I worked with another CRNA, Jennifer Lanzalotta-Rangeley. Jennifer. She they had grants going, and she hired me as her grant manager, and we had a couple of programs going in a rural setting. And one of the things we wanted to do to start to eliminate stigma, or at least lessen it, was put somebody with long-term recovery's face on a billboard that says, people say recovery doesn't happen, but I have blah, 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 and I'm giving back to society, and I have this many years of recovery. I made the mistake of saying, I guess, at a meeting, well, if nobody in the community will do it, you can stick my face on that billboard. And I didn't think anything more of it. And I was driving out there one day. It was an hour drive to get out there. And there's my face on a billboard. You could at least warn me that I was going to see that. But it was interesting because I do a driver intervention program out there every so often. And people have come in and said, you're the guy on the billboard. Oh, my gosh, I can't. And even my kids were like, Dad, that's so cool that you're on a billboard. And so it does have an impact. And I think that's the biggest thing that I would like to see go away is if you have this disease called addiction. I mean, I'm being treated for melanoma. Unfortunately, I'm 6 years right now doing okay. But it's one of those things where we got to talk about this so people can get treatment, because it's like any other disease. The sooner you treat it, the better the chance of full recovery. And based on this disease, working as a counselor, our shame and guilt is so bad that we don't come into treatment until we almost are forced into treatment. And by that time, the disease has progressed to like stage 4. So it's going to be very difficult to have prolonged recovery. If we can get them in, but people don't want to go in sooner. I don't want anybody to know. Oh, yeah, it's just really frustrating. Very frustrating.
Well, Jack, I agree. I think the more that people hear about it, the more you talk about it, the less stigma. I mean, there's always going to be some stigma from someone somewhere.
Yeah.
You're never going to get rid of that. But the more you talk about it, it brings more of acceptance and understanding. And I think that's the whole idea behind this and what's going on, is that people need to hear about it. People that have never struggled with it, Linda, you still need to hear about it. You need to understand it so that you can support those people that have gone through it or are going through it in the right way. So Linda, how can our listeners learn more about peer assistance and wellness, and how can they get involved?
Well, that's a great question, Jeremy. There's so many ways they can, but in terms of just at the national level, they can go to the AANA website, look at peer assistance and wellness and things like that. There's just a huge amount of resources. There's also now a micro-credential that was established, a wellness ambassador's micro-credential. And it has just, a lot of different topics too. Certainly substance use disorder and stigma and things like that, but a lot of other things. There's also involvement through this wellness ambassador credential that can be done at the state level. You can speak at a state meeting. You can, be involved with your colleagues at work and, really educate yourself on it. We know that knowledge is power, and, really having that, like you say, the awareness and promoting that takes away some of the stigma, not all, but it also makes us realize that everybody is human, and, we need to not be afraid of it. We need to address it and try to find, solutions for helping people that have substance use disorder.
Amen.
Amen.
Well said.
Well, as we wrap up here, is there anything that either of you would like to get across to our listeners or kind of end on at this point?
I would like to say if you see something, do something. And that AANA helpline, which I know you will put in the show notes, is 1-800-654-5167. It's been the same number since we decided 1983. And, thank you both for always bringing light to substance use disorder in the anesthesia provider. I just very much impressed with Beyond the Mask and both of you. So thank you. Really warms my heart.
Yeah, me too. Thank you so much.
Thank you, Bridget.
Yeah, I'd like to thank you for the last time you invited me to speak as well as this time. And for anybody that's listening, it's not hopeless. There is a light at the end of the tunnel. Just reach out. That's what we're here for.
And the light is not a train.
Well, in my instance, it might be, but no, it is not a train. Thank goodness.
Right.
Yeah.
That's right. All right, Linda?
What I'd like to say, to everybody again is that it is important to know the whole picture, to really look at everything. I mean, people who are involved for, a variety of different reasons. You don't have to be in recovery to be involved or want to know about it. These guys accepted me as a cucumber, and I'm always, eternally grateful for that. Since I felt like I came into it with clearly not knowing anything, but having the interest. So I want people to think about that. Also, to really celebrate the accomplishments of peer assistance and, the addition of Parkdale and how that, has really moved everything forward so quickly. And I think we'll continue to. And it's people like us, all of us who are interested, all of us here today, that are going to help move that effort forward as well.
I agree. And Linda, I've never heard that term, but,
Does that mean that everybody else is pickled? You're a cucumber and everybody else is pickled?
Yeah, those of us that have gone through the fires, we've also gone through the brine. Yeah, and once you're a pickle, you're always a pickle, but yeah.
Okay, all right. I knew there had to be some meaning there. So now every time I see you, Linda, I'm going to think about a cucumber.
Yeah, well, that was an artism too, and art used to, because he would say, "Oh, it's because you're a cucumber," and I was like, "What does that mean?" So Jack explained it well. Yeah.
Oh, wow. Well, I think that's a great place to end this. We really want to thank all three of you for doing the amazing work that you're doing. I mean, Jack and Bridget, you've been there, you've lived it, you continue to live it every day because you never get over it. You get around it every single day.
One day at a time.
We want to thank you for telling your story and all the good work that you're doing. And Linda, as always, you do a phenomenal job, and you put your heart and soul in this, and it shows, and we all know that. So thank you all three for what you've done for the CRNA.
Absolutely.
Yeah, thank you all. Yeah,
Thank you all.
Thank you.
And Jeremy might shoot me for this, but I'll tell you why this is a passion of mine and Jeremy's. Both of us are adult children of alcoholics.
Wow. Thank you for sharing that.
Yeah.
It's very
we
meaningful.
appreciate that. Yes. Yeah. Doesn't it just affect the person that has it?
Very true. Very true.
Yes, it is a family disease for sure. So thank you for sharing that. You have my support also, always there for
Absolutely.
I always tell friends, I don't put a lot of stuff out there like that, but sometimes in life, you don't always have to know what you do want, but you better know what you don't want.
I like it.
Good point.
I think that's probably the point for Sharon and I in that comment. So
Yeah. I'm going to steal that.
Yeah.
It's good for a line or two occasionally.
Yes.
I love you guys.
And on that note, Sharon, I think it's a wrap.
Thank you for tuning in to Beyond the Mask. If you enjoy the show and want to help us grow, the best way to support us is simple. Leave a review on your favorite podcast platform, share the show on social media, and tell your friends. Your word of mouth is what keeps us going strong. We're proud to consistently rank in the top 50 medical podcasts nationwide and to be #1 in the CRNA community. All thanks to listeners like you. Your support helps us stay there, and we couldn't do it without you. We'll see you on the next Beyond the Mask.